Urocystoliths in a 4-year-old Shih Tzu dog by Katrina Ann O. de Guzman. Contents. For 1 patient's info, 2 history, 3 clinical signs, 4 diagnosis, and number 5 treatment. Patient's info, name, Bella, age, 4-year-old, sex, female, breed, Shih Tzu, unvaccinated, history, November 22, 2024, at the Philippines Veterinary Clinic, Sta Barbara Baliwag, Bulacan, Bella was presented to the veterinarian. According to the owner, the dog was observed to have an unusual urine deficit. Clinical signs: hematuria, bar, bright, alert, responsive. Then, the veterinarian proceeded with the CBC and initial X-ray. Bella was observed to have bladder stones and low platelet count. The patient cannot be operated immediately due to low amount of platelets and because the patient is suspected to have blood parasitism. Follow-up checkup after a week was advised to the client, and here are the results. Initial radiograph and CBC result of Bella. X-ray result after a week and before the cystotomy. Bladder stones, also known as urocystoliths, are stony collections of minerals, crystals, and organic material that collect in the bladder. The 2 most common types of bladder stones are struvite and calcium oxalate. Stones can rub against the walls of the bladder, causing inflammation and pain. Bladder stones can also block the urethra and make it difficult or even impossible to urinate. Depending on the minerals that make up the stone, its shape and size will vary. While general management includes surgical removal and medical management, the appropriate treatment protocol depends on the location of the urolith and its chemical composition, as well as on patient-specific factors. Initial treatment. The vet prescribed medicines: prednisone 1/2 tablet bid, and iron plus folic acid 1 capsule sid to increase the platelets of the patient. For acidifying, methiovet 1 tablet sid was included in the medication. The vet prescribed LC-doxycycline 1 tablet sid for the probable blood parasitism of the patient. The vet cannot perform the cystotomy immediately because of the low platelet count of the patient and suggests that the patient must come back after a week with the intake of the prescribed medicines. Final treatment. To remove the stones in the bladder completely, the licensed veterinarian perform cystotomy. Also, pre-anesthetic and anesthetic regimen was prescribed: atropine 0.35 milliliters and Zolotil 0.55 milliliters. After the cystotomy operation, the patient was prescribed to have post-operation medicines including dexamethasone 1 tablet sid for 5 days for anti-inflammation and cephalexin as antibiotic, bid for 7 days. Continuous intake of doxycycline, prednisone, iron supplement, and methiovet was advised by the veterinarian.